Hello, I'm Dominic Davis, founder of Pink Therapy. We've been training mental health specialists worldwide to work with gender, sex, and relationship diverse clients for many years. This podcast puts the lives of some of these incredible, pioneering therapists front and center and gives us insights into what it's like to be LGBTIQA+, or as we prefer, GSRD, speaking in their words. Good afternoon. Thank you, Christian, for joining us today on the new podcast on becoming a GSRD therapist. I'm glad you could spare some time. I'm aware there's a time zone difference between us, so you're probably fresher in the day than I am. But you're looking good and fresh anyway.
Thank you.
So, Christian, tell us your name, your pronouns, where you are in the world. Let's introduce yourself.
Yes, Dominic, thank you so much for having me. So, hello to everyone here from Toronto in Canada, East Coast, Northern America. My name is Christian Schulz. I go by he and him pronouns, and I self-identify as a cisgendered gay married man.
Right. I love that you've got the city name pronounced correctly as well, without the T. Toronto.
Exactly.
Yeah. You've really acclimatized there because you've lived around the world, haven't you? You've been in many places.
I originally grew up in Berlin in Eastern Germany, and then I am German by original background. But then I have lived abroad quite a bit. I've lived in the UK. I've lived in the United States. Been in Switzerland and in Sweden. But I guess for the last 8 or 9 years now, I'm losing track a little bit. I've lived abroad outside of my original home country, Germany. Lived in the UK in London for just under 5 years, and then I moved over to Toronto in October 2019, which was, unfortunately, shortly before the beginning of the COVID pandemic.
Just before COVID. Yeah, it's a beautiful city. I've only visited once for a short period, but I really enjoyed visiting. I'd love to see more of Canada. I think Canadians are just nice people. They're like Kiwis. They're just really nice people. It's a generalization. It's a generalization, of course. I'm sure you meet plenty who aren't nice, but it just feels like it's a country where people care about each other a bit and are respectful and cautious around each other, like polite. Lots of sorries.
Kindness is the word that comes to mind for me. There is really an attempt to be as kind as possible with each other, a-confrontational, but in a very caring way, a-confrontational. I really like living here. It is interesting, though. Everyone who looks at Toronto from the outside often speaks quite highly of it and is interested in it. And everyone who lives in Toronto, at least the majority, always wants to be somewhere else. Most often, London in the UK is mentioned as the Mecca to go to.
Well, I guess the grass seems greener on the other side of the fence, doesn't it?
Exactly. Yeah.
Yeah. Tell us a bit about what you're working on at the moment, Christian.
Well, so by background and training, I'm a medical doctor. I have worked in medicine for 17 years now. Of course, first as a medical student and then later on as a resident or trainee. I have a background in psychosomatic medicine and medical psychotherapy, and then later on general psychiatry area as well in the UK. And then more and more I developed a special interest in palliative care and palliative medicine, which is symptom control, symptom management, and end-of-life care for people with life-limiting illness. And I've worked in this area for a long time now, and then came to Canada to work in a specific field which is called psychosocial oncology. So it is basically the psychological and mental health aspects of cancer care. And this is, relating to the whole trajectory of cancer care, starting with early primary screening, all the way through diagnosing, finding the right treatment, and surviving cancer or ending up in a life-limiting situation. And the related grief that comes along with it. So this is the area I work in here at the University of Toronto and the University Health Network, UHN. And specifically, I am based as a psychiatrist within the Princess Margaret Cancer Center, which is one of the biggest cancer centers in the world.
It seems quite a new discipline, a new subspeciality, cancer care for LGBT people. Am I right in that? Are there other units around the world, or is this something that's pretty unique to Canada or to Toronto?
The specific aspect of looking at cancer care from a sexual and gender diverse perspective is, I would argue, relatively new field for clinical and academic pursuit. But of course, it's not new in terms of cancer care, because cancer care has always had diverse people and intersectional identities patients, but they weren't always really treated well. And we unfortunately also know that there is a lot of significant gaps in terms of accessing care. It is relatively new here in Canada. However, I need to give credit to those who were the pioneers. Queering Cancer CA is a website of colleagues with whom we are collaborating, who come more from the western coast of Canada, who have really established this idea of the specifics of queer identities and cancer care a couple of years back. In the United States, we also have quite an active network of professionals who work in this area. Other than that, if we look at it more globally, there still is certainly a lot of room for improvement. The UK actually also has quite an interesting hub around this topic.
Are there increased risks for LGBT people for particular types of cancer?
It's a straightforward question and an impossible answer to give quickly. But the reason I'm saying this is I really want to acknowledge that there is a lot of bias in what we know and a lot of bias in how we connect risk with identity. So, I mean, I was fortunate enough to study within the program and your program, and it was as part of this program that we actually learned and realized, and it was very helpful for me to notice that there is publication bias, that there is unconscious bias elements that influence how we look at data and how we look at scientific facts. So that was the bit roundabout answer. More direct answer, I think what we can certainly say is that there is clear, real-life, objective evidence that people who come from a sexual and gender diverse background and who happen to have a cancer diagnosis or to be the chosen family members of someone with a cancer diagnosis have much bigger trouble getting access to care, be it because they don't feel comfortable with reaching out for care, be it because they get discriminated against, or be it that their specific situation of cancer care is not taken seriously enough. And then, of course, there are sub-categories of very specific cancer diagnoses, which do happen to occur more often in sexual and gender diverse populations.
Give me a couple of examples.
So one example is, for example, anal cancer is a good example, which we experience more often, which has to do with sex practices, which has to do with the way lifestyles can influence risk factors. We do also know that there is a higher frequency of patients from a sexual and gender diverse background of smoking tobacco, which then in itself leads to an increased risk, a general risk, not a specific, a general risk of increased cancer occurrence. So those would be two explicit examples. I want to say that the anal cancer example is heavily related to HPV. So this is more related to a third agent and not so much to the actual identity issue, which then goes back to the point I was trying to make. We need to really understand why there is a higher frequency and whether this is really directly related to identity or not.
Interesting. And lesbians are more at risk of, is it breast or cervical cancer? I think I saw a lecture but I can't remember which one it is.
So for both, there seems to be data that seems to suggest either way, but I would argue that at this point in time, we actually don't really fully know.
Oh, really? Okay. Right. Well, there's more to learn then. That's it. But you're particularly involved in the impact, the psychosocial impact on people accessing care and feeling understood and respected and helped with this in their cancer journey, not just at end of life, I guess, but during the whole diagnosis.
End of life is certainly part of the work I'm doing, but it is, as you say, the whole trajectory, the whole journey, and yes, the psychosocial elements are, I guess, probably the mainstay of the work that I'm doing with my division and my team and my colleagues. And we have a dedicated program, the Sexual and Gender Diversity in Cancer Care program, which I co-founded with my wonderful social work colleague, Marco Kennedy, about 2.5 years ago. But what we are also very interested in, and I think this is where we really also had the most success in changing culture, is how environmental, societal, and organizational factors influence the impact that sexual and gender identity has on your cancer care experience. So I'll give you a very, very straightforward, banal example. When I started working at Princess Margaret in 2019, there were barely any professionals, patient-facing staff who were wearing lanyards, rainbow lanyards. It's a very, very small example. Over the last 2.5 years, we've now come to a situation where I would argue, I don't have a robust number, but I would argue 70% of our patient-facing staff are wearing rainbow lanyards. This makes a huge impact on someone coming with their own anxieties, their own trepidations, to their very first assessment or cancer diagnosis conversation with their oncologist, if a signal of environmental inclusivity. Now, that needs to be followed up, obviously, with actual inclusivity. And it will be detrimental if people are wearing rainbow lanyards but don't even know what they are there for.
Yeah, I was just wondering, have they had some training in what this means and how to be culturally sensitive to our communities?
We're very engaged in this whole educational pursuit, and so this is what I wanted to mention here. It's not just clinical care that we're focused on, but really educational interventions, and also understanding better what works and what doesn't work. So, for an example, these small elements of change have had a real impact. We've now have a gender inclusive bathroom or gender inclusive bathroom signage across our cancer center, which initially was difficult for some of our patients. The more heteronormatively organized patients were wondering, why does that need to happen? But we had conversations and we were having good dialogue, and now it is accepted as the new norm. So these environmental elements were really, really important. Over the last 12 months, we've given more than 20 talks inside our center, provincially, nationally, even internationally. And these conversations we're having, they're not always easy. It's not always easy to come across or bring across what we try to speak about. But we have, I would say, in the vast majority of our experiences, positive interest and curiosity, and that leads to an opportunity to educate. So yeah, things are actually going pretty well with our program, and we're quite excited to get the attention that we need to make actual change.
Right. It's interesting, the lanyards. Your predecessor on this podcast last month was Julian Sardi, and I don't know if you heard the show, but we were talking there about the importance of lanyards. And here in the UK, they've been a big NHS thing for some, I think some years, certainly pre-COVID, but I wasn't sure whether that that took off elsewhere in other countries. So it's interesting to know that you're doing that in Canada too. And yeah, I think symbolically just putting it on every day is a way of outing yourself. For those who are queer, it's a way in which I'm showing who I am today to my patients. But not everybody wearing one, of course, is going to be queer.
And that's the interesting piece. There has been a transformation in the symbolism that goes along with wearing a rainbow lanyard. Initially, it really was a form of micro coming out, which I find actually quite problematic. Problematic in the sense of, why is it imposed on us sexual, gender diverse people to over and over again come out to a world that tries to normalize otherness? So I remember when I first wore my first rainbow lanyard, as confident as I often come across in who I am and what I do, I was really nervous. And I was asking myself, why am I so nervous? What is it that is different? If someone asks me, I would tell them who I am. But yes, it is a form of vulnerability. And I think Julian also spoke to it last time, which has now, however, because we have so many allies and people acknowledging diversity across the spectrum who do not themselves identify as sexual and gender diverse, wearing them, it is no longer for me a signifier of my individual sexual and gender identity, but rather it has now become an organizational identity. Princess Margaret welcomes diversity, and that is what we are aiming for.
Right. Yes. Yeah. It is interesting how one can feel very vulnerable when you don't have a control over who gives the microaggressions out. Whereas if you're on a one-to-one, you can choose whether you disclose or not, and how you disclose. So yes, it's a rich vein that I think doesn't get enough attention really when we're asking people to wear them. Tell me a bit about life, how life is for GSRD folk where you live in Toronto.
I think it's been about 10 years ago or so that I first had an opportunity to visit Toronto. At that point, I wasn't thinking at all about ever moving to Toronto. And the thing that really struck me when I walked through the streets of Toronto was I felt so safe. And I asked myself where the safety came from, because there's just as much street crime as in any big urban city. But the sense of safety came from a true sense of inclusivity and diversity on the streets, visibly, wherever I was looking. And it did feel distinctly different from my experiences I had in London or New York, where, yes, there is diverse culture and there are many people of all sorts and shapes, but there is a stronger sense of separation, pocketing, a pocket of this, a pocket of that. In Toronto, it all seems much more intermingled. As a matter of fact, if I got my stats right, I think in 2030, we will reach the point where more than, maybe it's already the case today, but around the next couple of years, we'll reach the stage where more than 50% of Torontonians will not have been born within Canada. And so that creates a milieu of otherness as normalcy. The norm is to be different. And that is wonderful. And that is also helpful from a GSRD perspective. We do have a pretty vibrant community here in Toronto. We have problems too. That is for sure. We have microaggressions, macroaggressions. We have discrimination. We unfortunately, especially for our trans folks, have the same high risk of abuse and assaults, even death. And, we just had the Trans Day of Remembrance, which reminds us of this on a annual basis. And yes, Canada is not free from those kind of ugly and painful events. But we certainly, I would say, especially here in Toronto, are one of the global communities that I would say is most open to inclusive, diverse thinking and accepting difference.
Here in the UK, where that has happened, I think there's a big pushback from the white host neighbourhoods in certain parts, certainly certain parts of East London, Essex, for example. There seems to be a lot of hostility being whipped up by the political right against these bloody foreigners coming in here and taking our jobs or whatever. I don't get the sense that that happens in Canada. Not from my mild readings of the papers. Does it? Is there a resistance to this this multiculturalism and diversification?
You're putting me a bit of it into a tricky spot here, Dominic, because I don't want to make political statements so much. And I will.
Just your impression. Just your own individual impression.
Well, I will say one thing. That's what's a bit triggering for me is there's also a reason for I left the UK for those reasons as well. When I came to the UK, certain political events led to the UK being the place it is today, and that's where I want to leave it at.
It's not something I'm proud of about our current and our recent past. So I'm interested to kind of learn, how can other places get it done right? How does New Zealand manage it better? How does Canada manage it better than we do here?
I mean, Canada has always, from a historical perspective, very strongly been an immigration country. It was always, from a national identity, a country open for all. Now, that is also an oversimplification, of course, but there is definitely a stronger sense, as I feel and understand and experience it, of welcoming immigrants, welcoming refugees. And as a matter of fact, it is also part of the legislation of this country. There is, of course, political difference across the different provinces. Ontario, I would say, is probably similar to BC, but mainly Ontario is one of the most colorful and diverse provinces. There are other provinces where that doesn't seem to be the case so much, but I don't want to speak for those because I don't live in those provinces.
Sure. That's not really the purpose of the podcast either. So I'm just curious about how it gets handled differently or how it's experienced differently. And what I'm hearing is that you feel very safe there, and it's great to see so much difference, not just queer difference, but differences of all kinds.
Maybe it helps if I talk about the following story. My colleague Margot Kennedy, who, as I said, co-founded our program with me, she told me that when we initially met in 2020 over a cup of coffee, that's how our program got started. She told me that 20 years ago in our own cancer center, when she was trying to celebrate Pride, she found herself in situations where people were tearing down the rainbow flag from her individual office door, or she had put out flyers and brochures with information around sexual and gender diversity, which she then found an hour later someone dumped into a bin. Now, so we're talking 20 years ago. Now we're finding ourselves in a situation, and we're quite excited about this, where not only are we invited to do the work we're doing, but we're actually getting substantial funding support by the organization, and also receive a lot of national attention within Canada around this topic. People from Montreal just 2 months ago had a large group of 100 oncologists who listened to our pursuits and our program, and afterwards said, we need to become a satellite of what you're doing there in Toronto, because this is really cool.
Yeah, I think things are getting better in general, for sure.
In Canada.
In Canada. Well, I think across the world in different parts, in different ways. I mean, Singapore has only just changed its penal code, so it's now no longer illegal for two men to have sex in Singapore. I mean, there are lots of there's a ripple going on.
I agree with you, Dominic, but I need to put it there that I'm very, very concerned about what I'm seeing in our the big United States of America situation, where things seem to be going at a very fast pace backwards. And so that's what I was referring to.
Okay. Yeah, you're much closer to that than I am here, for sure. Tell me now, let's look at now, what are some of the current challenges facing your community in Canada? And maybe let's focus it a bit on what might be some of the challenges facing GSRD people with cancer in Canada, so that we can kind of try to understand at a more localized level how things are.
So first of all, I've already spoken to GSRD in cancer in the context of accessibility to care. This is a really huge issue. We actually have mortality differences in terms of, for example, to take the most explicit example, some trans folks really die years or decades on average earlier than others with similar cancers, because they just do not get the screening care and the support that one would typically expect. Now, this has a multitude of reasons, but this is one example. Another example is that to be in cancer care itself is, for any person, independent of their identity, an existential challenge. If on top of this you're dealing with intersectional identity minority stress, it sometimes can get very confusing whether you can feel safe or not feel safe in a certain treatment environment. And again, I think the onus is on the cancer treatment team and the organizations providing the cancer care to take this stress away from our folks and give them a very robust, strong sense of safety so that they can be brave enough to share all their concerns, all their anxieties, and all their suffering with us. Because cancer care does include at times suffering, unfortunately, for many people on a physical, psychological, social, and sometimes spiritual level. There is the problem of, I spoke to it earlier, of this idea of micro coming out, where for every healthcare provider you meet, you feel like you need to explain over and over again. And on the other hand of the spectrum, we've just introduced a new healthcare information system to our organization, which now has a module which is quite novel. Has a module where patients can proactively through their mobile phones or whatever device they want to use, input their pronouns, their name, their gender identity and sexual orientation, as well as their relationship diversity status, if they so desire, which is wonderful. And we are quite proud of this achievement. But what we're also realizing, and I can speak to it myself, what we're hearing from people is, well, who is going to see this information? Why am I going to share this very personal, intimate information with a healthcare information file that might be looked at by so and so many people who don't need to know? So this is another vulnerability where I don't have the answers yet. How can we maneuver on the one hand to be inclusive and create a safe space, but at the same time having to acknowledge that sharing identity details is always very private and always very, very intimate, and therefore might not be the choice, even in the most progressive, confident person, the right choice at every point in time and every turn of a cancer care situation. I don't know. Did I lose track of the question?
No, I think you answered the question, particularly about the experience of trans people with cancer and how they're likely to die quicker.
Yes, but that's not because they're trans, but it's because being trans creates the societal reactions which then lead to all the barriers that are encountered. This is so important to me, that we don't make a shortcut that a certain identifier means that you're going to die earlier. No, absolutely not. It's the opposite. And maybe allow me one more example, which is quite close to my heart. We call our work, our program, and social media, etc., our handle is PM Chosen Family. So Princess Margaret Chosen Family. And the reason we're doing this is because all of us have experience of caring for and treating SGDC, so sexual and gender diverse patients at the end of life in a palliative care situation. And unfortunately, because we're such a big cancer center, we quite frequently encounter young folks who unfortunately have terminal cancer. And we have several stories that we experienced and I experienced personally, where it was quite heartbreaking for me to see that there was a reluctance, even in the dying patient, to really open up about who they would like to have at their bedside and who has a right to be at the bedside and for what reason. And so there is a lot of work that we still need to do. And my dream and hope is that we will, going forward, maybe have inclusive care at this end as well, but also is that we will have a hospice that will specifically focus on the sexual and gender diverse population. We have a particular hospice back from the AIDS era here in Toronto specifically, which is world renowned, but it is mainly focused on care of HIV positive patients. I hope that's a little bit of my personal hope for the future, that we will be able to create a hospice and palliative care environment that will specifically be dedicated to sexual and gender diverse patients and their chosen families.
That's good. Thank you. I'm mindful of time, and so I'm gonna take that as the question about what are you passionate about, because you're clearly quite passionate about your work and about how you're going to make change here, and that's really wonderful to hear. Tell me next maybe what motivated you to undertake our program, because you were having to get up at silly o'clock in the morning due to the time zone differences. It was quite remarkable that you were prepared to take that on. So tell us a bit about that.
It really was about community. Really, that's the first thing that comes to mind. During the COVID pandemic, I came here in October 2019. My husband was back in the UK and remained in the UK for the time being, then joined later on. But I found myself here in Toronto in a very novel situation. All of a sudden, because of the lockdown and everything that happened, also quite socially isolated. Isolated in a situation where I was also trying to find my professional footing and to find a way of integrating my identity and my desire to change healthcare around the topics we discussed. And so taking your program really meant that I was all of a sudden connected globally with people who were like-minded and had a genuine passion around the same topics. I also, to make myself vulnerable, had questions about myself, and I wanted to learn more. What are the ways of how I can understand myself better with regards to my own gender identity, sexual orientation, preferences, kinks, etc. And so all of this motivated me to come and work with you and the group, and it was an absolutely marvelous, fantastic experience. Although I admit being up at 4 a.m. in the morning was not always fun.
No, absolutely not. No, absolutely not. So, okay. And how has it, what was the most interesting part? I think the most interesting part you were just saying there really was finding a sense of community and connectedness with other queer therapists. Is that, would that be right, really?
It would be right, but it's also just as true that because it was a global program and because it was an online program, there was also at the same time the hope that one day we were going to meet or are going to meet in person, which hasn't happened yet. There's still something missing. Yeah, next August it will be. I'm looking forward to it. No, I do want to say there was also, it sounds a little bit as if I'm promoting the program, but maybe I should. There was just a lot of really, really exciting intellectual challenging that happened with the readings, with the conversations we had, with the differences we had in our class. in terms of positions, but also identities, and finding a space in which questions could be asked without retaliatory intent. That was really, really powerful and helpful. I really learned a lot over the course of the year.
Great. Thank you for bigging us up like that. That's wonderful to hear. How has it changed your practice, Christian?
So it has had an influence on the whole development of the program I was talking about. So I guess that's a fair point I need to mention as well. I had started with the sexual and gender diversity and cancer care program together with Margot and Brendan Leiber in 2020. And I did your program in 2021, leading into 2022. So it was during the development of the program that I was also looking for guidance and some external validation. So that was part of it. So whatever I learned, I immediately applied to our program. So I can justifiably say, Dominic, that Pink Therapy's diploma, the influence, the work we're doing here now in our program. And so far, it has changed how I think, how I talk, how I communicate about topics, but it has actually mainly influenced how we implemented the program here at Princess Margaret.
Fabulous. That's really great. Very exciting. Well, coming to the end, so recommend me a book or a film, because I feel like I'm always open to learning more and more from the people that I'm involved in teaching and training. So,
that's a very good one. Let me think. Any book relating to our topics, or
any book relating to our topic, something that's moved you that you think this is good, that you should read this.
One book that I really think would be a good fit for the overall topic is Staring at the Sun by Irvin Yalom. I'm not sure whether you came across. So Irvin Yalom is an existential psychotherapist.
He's very famous, yeah. Familiar with him, but not the book.
Yeah, so Staring at the Sun is his quite accessible, shorter version of his thoughts around existential therapy and death anxiety. And so I find it a very accessible and a helpful read to find your own language around existential topics. There is one movie that I just cannot remember for the sake of it right now, which really moved me immensely, and I watched it recently, and I will have to get back to you. I don't have it readily available. For some reason, I'm blocking on it right now.
Well, when it comes to mind, drop me a message for sure.
Yes, I will do.
Last question. As a bona fide paid up fairy, I grant you 3 wishes. What would you like to wish for?
I just imagined you as a fairy, and that really made me feel very happy.
I'm claiming it all.
Yeah. So 3 wishes. The first wish is that the life we live here in Canada will become more the norm in the future than the life our neighbors live at the moment.
Mm-hmm.
The second wish is that we will favor diversity and inclusivity in cancer care. I'm going to be specific about my line of work, to the benefit of those communities who are underserved at the moment, and that we will do this very quickly. And the third desire I have is that the Pink Therapy program and all their satellites are going to keep growing, because I really truly think that there is some really huge potential in having more and more GSRD therapists. Great work that some of our folks are doing already.
Yeah, lovely. Thank you. Well, thank you very much, Christian. It's been lovely to have this time with you. And I look forward to meeting you in person next August at our colloquium.
I'm super looking forward to this, Dominic, and thank you for everything.
Take care. Thank you for listening to this podcast. Please click like and subscribe to hear when the next one is released. If you're a therapist looking to enhance your knowledge and skills with GSRD clients, please check out our training website, pinktherapy.org. We run 1 and 2 year specialist training programs online, as well as offer a wide range of short CPD modules. Thanks again for listening to On Becoming a GSRD Therapist.